Despite the World Health Organization's declaration in May 2023 that COVID-19 was no longer a global health emergency, Dr. Tedros Adhanom emphasized that the virus remained a threat, prompting countries to shift from emergency response to integrated management alongside other diseases. Dr. Gilbert Mateka, the district health officer at Kabale district, confirmed that since the festive season and into early January, they have observed patients exhibiting consistent COVID-19 symptoms, leading to testing and identification of 5 initial cases.
Most of the 20 cases that we have seen have actually been managed as outpatient. Not all of them have to be admitted. Majority of the patients have mild illness that does not require admission, so majority of them were managed as outpatient. A few were admitted, and among them are those who, like I've said, had other comorbidities and therefore had severe disease and passed on.
However, the number escalated to over 20 cases and 2 fatalities by the end of January. He noted that most cases were managed as outpatients, with a few requiring admission due to concurrent illnesses.
From the time of the festive days, the end of the year, that is Christmas and the New Year's, early January we started seeing a number of patients presenting in outpatient departments with signs and symptoms consistent with COVID-19. And the clinicians did some tests and some of them turned positive. I initially had only 5, but as I speak through the month, we have registered up to 20 cases and unfortunately recorded 2 deaths.
Dr. Mateka conveyed his apprehension regarding the public's perception, highlighting the prevalent belief that COVID-19 has disappeared, emphasizing the significance of sustained vigilance, urged individuals to remain informed about vaccinations and make use of booster doses while maintaining adherence to safety protocols.
The challenge is that people continue to think that COVID-19 is not around. They think COVID-19 is a long-gone case or condition. But we want to continue to sensitize the communities to know that COVID-19 is around, and therefore we should continue to live observing the precautions. We are all aware of the different standard operating procedures or things that we can do to prevent acquiring COVID-19. It is important that we assess our risk and take appropriate precautionary measures.
Emmanuel Inebiona, the Health Ministry spokesperson, stressed the continued need to remind the public about adhering to COVID-19 prevention protocols and promptly seeking testing if they experience symptoms even slightly resembling the virus.
I want you to understand is that COVID has never gone away. There are always cases which are mild and treated, but people don't come out to say. So if there are some admissions, that is really routine and normal. Patients come and they are treated, and people need to continuously observe the preventive measures that were put by the Ministry of Health, like social distancing, hand hygiene, whenever you have you're looking after someone who is positive.
Reports indicate that by November 2023, 72% of the global population had received at least 1 COVID-19 vaccine dose, with 13.6 billion doses administered worldwide, significantly reducing severe illnesses and hospitalizations.